Hi everyone, Dr. Jay Mehta here. I lead the chronic pelvic pain and neuropelviology clinic in India, the first of its kind. But today we are going to teach you something important. What are the symptoms for chronic pelvic pain? Remember, when we see patients in OPD or when we see these patients online, because quite a lot of them consult us online from across the country, the first symptom which they tell us is that they are having vague pain in the abdomen. They are unable to describe this pain. If I ask them to use a finger and point out, tell me where exactly is your pain with the help of a finger, it is very difficult for these girls to point out. Okay, that is because it is generalized, it is vague. They'll be like, sir, there is a discomfort. It is usually present on most of the times of the day. It is present, let's say, when I'm driving back from work. It is present when I get stressed. It is present when I'm, watching TV in the evening. That is the complaint, correct? That is the reason why it is very irritating, because you can't actually figure out if the pain was here today and there today and then there tomorrow. This is the confusion. Please remember, this is chronic pelvic pain. Now, if in case you have something which is very specific, like for example, you have pain during menses, pain while passing periods, this is called dysmenorrhea. This usually indicates something lower down in the pelvis. If you have pain or discomfort while passing stools, it indicates something lower down in the pelvis, part of your large intestine, rectum. If you have pain while passing urine, it indicates something related to the bladder. If you have pain while walking, pain while sitting, and pain while standing up, it indicates there is some nerve involvement somewhere. But all these are known causes. All these are either related to endometriosis, adenomyosis, nerve entrapments, multiple other things, right? This is something which you need to keep in mind. In all these situations, you need to go and see a chronic pelvic pain specialist. If you think it is endometriosis diagnosed on ultrasound, please go and see an endometriosis specialist like us or someone else who is a genuine endometriosis specialist. Do not waste your time seeing routine doctors and routine gynecologists, because they will misdiagnose and you will have a prolonged interval before you actually reach the doctor. So don't let that happen to you. But if you are having any of these chronic complaints, you need to see a chronic pain team. The team consists of a specialist, a neurologist, a physiotherapist, and a psychologist. And in most of the situations, all of us have to work together, because it is not just treating of the pain cause, it is also treating your mind as to how do you interpret the pain. Okay, that is called behavioral therapy. And I'm going to be talking about that in my next videos.